Welcome, class. My name is Shelley Mohang, and I will be your moderator for this debate. This debate will discuss the pros and cons of elective C-sections. We will answer the question, should there be an elective option? We will identify elective as any instance that does not merit a C-section for emergent or medical reasons. Each person will have 8 minutes to present their side. Speakers will be asked to address the following topics: health of mother during delivery and post-delivery, the health of the baby during delivery and post-delivery, development of the baby, and financial considerations. The first to present their side against the option of elective C-sections will be Chrissy Grimm. Chrissy, you have 8 minutes to present your research.
Thank you, Shelley. Since the beginning of time, women have been given a miraculous opportunity to create and bear children. Most women's body can carry a full-term child to 38 to 42 weeks. During the gestation period, healthy women's bodies provide nutrition and controlled environment. The mother's womb is a greenhouse where babies grow and develop until birth. Toward the end of the gestation period, a woman's body prepares itself to give birth naturally in many ways. Her ligaments begin to soften, allowing more pelvic room for the baby to position for birth. The baby positioning itself is known as the engagement period, or more commonly heard of as the baby dropping. Pre-labor contractions help her cervix to dilate to approximately 3 to 4 centimeters or more. The mother's body is naturally opening to give birth to her precious little one. Elective C-sections that are not medically needed halts this beautiful and healthy process, potentially causing health, developmental, financial, and family hardships, in addition to robbing the mother of a natural birth story. For my first point, I'm going to talk about the health of the mother. In a German Federal Statistics Office, they did a systematic review that determined C-sections are bad for mother's health. Sadly, 1 in 3 women have a C-section. This is 21.7% of these are elective. Specifically, they found these points: risks during or immediately after surgery, such as infections to internal organs and severe loss of blood, which oftentimes requires transfusions. Postpartum complications that can result from clots forming in the legs and breaking off and going up to the lungs can be fatal. Even though my grandfather did not have the ability to have a baby, he had this happen, and it was definitely hard for our family. So this can be hard for other families as well. Obviously, it results in death, so that's very sad. Complications related to future childbearing include infertility, uterine rupture, ectopic pregnancy, and placental abnormalities. I had a friend that actually had a placental abnormality, which is the placental sac dislodging from the uterus, and it also caused her to lose her baby, which was obviously very sad and could have been avoided by having a natural vaginal pregnancy. Another point in the health of a mother is the fact that women are 3 times more likely to die in a C-section than vaginal birth. And let's stop right here and debunk a common myth. Vaginal delivery has no worse impact on sexual function than a C-section does. And why we're getting real here, in an emergency, a C-section does make sense. The World Health Organization says up to 19% of births should be life-saving C-sections. But when we put that in contrast to the number that the United States has, which is 33% of women choosing to have a C-section, this does really increase the rate of mom and baby mortality. Could be avoided. Now, in addition to the mother's health, we have to look at the baby's health. Again, from the German Statistical Office, we have another review, another systematic review. Once again, they suggest that the C-section poses a significant risk to the baby's health. This study found that the following complications ensue: increased risk for asthma, allergies, autism, and other respiratory diseases. There's also a greater increase for type 1 diabetes. The risks for immortality rate due to these things are great. The contractions during a vaginal birth help to force the fluid out of the newborn's lung, helping the babies to breathe clearly and avoid risky breathing scenarios. So the babies need the opportunity to have the contractions push the air out of their lungs so that they're not coming up with like pneumonia and stuff like that. Babies that travel through the birth canal are also given good bacteria, which does aid them in having better immunities. That's important because they have better immunities, they'll be healthier. Now let's take a look at the financial considerations. This will just be a simple look at this, but vaginal birth is up to $20,000. A C-section is up to $50,000. I don't know about you, but I certainly don't have that in my budget. I'd much rather pay the $20,000. That's an estimation, by the way. Let's transition and look at the development of the baby. One of the earliest developmental milestones is feeding. A study conducted by Melonius and Friesen suggests that after the surgical process that the baby loses that skin-to-skin contact and time to bond with the mom, therefore making it a little bit more of a gap in between when the baby can start to feed. This could essentially be bad for the baby and the mom. And as all of us could imagine, when there's a newborn in the house, everything changes. And the impact that has on the family is surmountable. A simple fact is the fact that when mom's gone, oftentimes things go downhill. So the longer mom's gone, the more the house isn't functioning like it would normally function if mom was there. So this in conclusion causes we could look and say that vaginal birth is more of a better thing because it helps for the development of the child along with having better financial grounding for the family, which can reduce the hardships families can face during the process of bringing life into the world.
Thank you, Chrissy. You made some excellent points against the option of elective C-sections. We will now hear from Misty Nelson. Misty will be arguing in favor of the option of elective C-sections. Misty, you will also have 8 minutes.
Thank you, Chrissy, for making some very valid points. And Shelley, thank you for the introduction. I would like to start by saying that although elective cesarean sections or cesarean sections on request are controversial compared to less medical intervention and vaginal birth, a common thread between both birth plans is the desire for a positive outcome. Everyone wants a safe birth. So, what is a safe birth? Hensi Goer, an ASPO certified childbirth educator and doula, indicates in her book, Obstetric Myths versus Research Realities, a guide to the medical literature, that safe birth is actively managed, predictable, and measured by the outcome of both mother and baby alive. In review of studies arguing both in favor of and against elective cesarean sections, we found little else to be universal. There are risks to be had by both mother and baby, developmental risks to baby, and implications towards healthcare costs on both sides. But a safe birth can be accomplished with a birth plan that includes elective cesarean section. Dr. Magnus Murphy, a urogynecologist and obstetrician practicing in Canada, admits cesarean sections come with risks involved, as discussed earlier by Chrissy, However, he notes the risks involving cesarean sections that are commonly cited are the ones associated with emergency surgery or cesarean section done on women with other problematic health conditions that were present before the pregnancy. In addition, studies that reference poor outcomes of cesarean section may erroneously include cesarean sections occurring after vaginal birth was unsuccessful. Therefore, the real reason for the poor outcome cannot be accurately concluded. This is not to say risks to health of the mother and baby should be ignored. There are also risks that are prevalent in women who have delivered vaginally, including pelvic floor dysfunction, which encompasses multiple types of urinary incontinence. I'd like you to stop for a moment and think about the things you do on a daily basis. You may go for a run, you may lift something heavy, or you may witness something that makes you laugh so hard your sides hurt you can't breathe and tears fall from your eyes. These are also regular occurrences for new moms, as they may be exercising to take off the baby weight, they may be lifting their baby, or they may be meeting for coffee with their best friend and they end up laughing uncontrollably about something the new baby has done. But imagine if all these things resulted in you being unable to control your urine. What if this happened in public? 20.7% of women still in childbearing age, or nearly 1 in 4, have a reality that includes forms of incontinence, including severe loss of bladder control. A 2003 questionnaire study of 15,307 Norwegian women, it noted that vaginal birth increased the chance of mild to severe urinary incontinence. And of those, 35% of the women who had vaginal birth and experienced some form of urinary incontinence, that urinary incontinence could have been prevented with elective cesarean section. And furthermore, 46 to 47% of the moderate to severe incontinence could have been prevented with cesarean section. It may not seem like a big deal. Oh, maybe a young woman has problem controlling her urine every once in a while, but for those who are living it, preventable pelvic floor dysfunction greatly impacts long-term quality of life. And it's also important to note that the subsequent treatments to remedy that problem that the women seek out can result in additional healthcare costs that we could argue ultimately have stemmed from the fact that they didn't have a procedure that could have prevented it from occurring in the first place. But an even bigger risk that is often attributed to cesarean section is that of mortality to either the mother, the baby, or both. And according to a 2015 study by Melonius and Fries, risk of maternal death from elective C-section is only minorly increased above risk of death of the mother during vaginal birth. Comparatively, maternal death from an unplanned emergent C-section that occurred due to distress of mother or baby during natural birth was significantly higher than risk during elective C-section or natural birth. So planning for a vaginal birth may also result in emergency C-section, and that emergency C-section carries higher risk for the mother than if an elective cesarean had been undertaken. Melonius and Fries went on to say in some studies they reviewed, no significant additional medical risks were found to be present for the baby during elective cesarean section. A call to further research for conclusive evidence has been indicated it is necessary. Consideration must also be given to the impact of cesarean section on the baby, the developmental impact of cesarean section on the baby. The biggest argument against cesarean sections in regard to the development of the baby is that they prevent extremely important skin-to-skin contact initially between mother and baby after birth that helps with bonding and facilitates breastfeeding. Our textbook that we're reading from now indicates in 2010 Bennington completed a study, and he stated the importance of early bonding does not necessarily override other factors impacting bonding. He continues that research has failed to show any longitudinal impact of early contact on bonding. And the view that early bonding is imperative to promote breastfeeding excludes the bond that can be developed between non-breastfeeding mother and baby, which is also a choice that expectant mothers have to make. And to address one of Chrissy's last points about the financial benefit to a natural birth, we can not only think in the short term. Yes, women who deliver vaginally without complication and are insured will see a lower cost, and they do have on average shorter hospital stays. But comparing vaginal birth with complications to cesarean births without complications, the cost is not so different. In 2009, the average cost of a hospital vaginal delivery with complication was $12,532. And cesarean births in the hospital in 2009 without complication had an average cost of $15,700. So a planned cesarean section completed by a skilled surgeon will also take on average 30 minutes, but our text indicates natural birth may last anywhere from 10 minutes to more than 3 hours. One could argue this is an unbalanced distribution of resources, and extended time for natural birth may also result in fatigue of the attending physician. And additionally, then when vaginal childbirth results in complication, this increases the physician risk of malpractice approaching damages of millions of dollars. So then circling back to my original statement, as you can see, little can be found to be universal when discussing childbirth practices. Arguments have been made supporting both sides. In 2006, a panel of experts from the National Institute of Health were charged with reviewing literature and expert opinion regarding the controversy surrounding elective cesarean sections. They concluded, after reviewing 1,406 articles, that, quote, the available information comparing the risks and benefits of cesarean delivery on maternal request and planned vaginal delivery does not provide the basis for a recommendation for either mode of delivery. So what does this mean? When research does not show a clear, conclusive advantage of one side over the other, it becomes an important issue of patient rights and informed consent. Historically, women have given birth under all kinds of conditions. They've given birth while working in the field, where after delivering, they pick up and continue working. They have given birth at home with a midwife, in the hospital setting with husband or partner being barred from the delivery room and under sedation. And they've also given birth by what has now been termed as naturally or a vaginal birth. Women have given birth with little to no medical intervention or with a high degree of medical intervention. We've seen the trends in the research shift. What doesn't change from a feminist perspective, which has been central to the evolution of women's health, is that women have the right to control their bodies and should be respected as able to make an informed decision about what is best for them. If they are lacking information to make that choice, it's at the fault of those tasked with providing the information. As outlined by Cohen and Ezer in their 2013 publication on human rights in the health field, when a patient has been sufficiently informed about the treatment options offered by a physician, the patient has the right to accept or refuse treatment for 2 reasons. The first being a patient has the freedom to decide what a physician or other healthcare professional will and won't do. And 2, it is unethical to physically force or coerce a patient into a treatment against their will if they are of sound mind and are mentally capable of making an informed decision. When we consider that relevant studies have not kept pace with the emerging trends in birth planning, and therefore concrete causal relationships between delivery methods and birth outcomes cannot be determined, what can we do? Logically, we can conclude on the basis of the lack of compelling evidence that if a woman who has reasonably been educated on the risks of all birth plan options, and barring any indication of markers of medical high risk, determines that elective cesarean is the best birth plan for her, physicians should abide by the woman's wishes to promote her overall general health and welfare. Thank you.
Thank you, Misty. You supported your arguments well. I'd like to take this opportunity to highlight a few important points on both sides, as well as give the listeners some insight to our findings. I feel I can speak for my colleagues that we had a difficult time justifying the pro side of elective C-sections. The research supported vaginal birth versus elective C-sections was strongly one-sided and supported a vaginal delivery whenever possible. Of course, we were able to find evidence supporting the use of C-section whenever it benefited the health of the mother or the baby. That being said, the topic of informed consent and a woman's right to choose what happens to her body were very convincing arguments as well.